Hi, this is Maureen Kluicki, Program Director for the Cedars-Sinai Accelerator, powered by Techstars. And I am joined today by Nick, who is the co-founder and CEO of CancerAid. Nick, thank you so much for taking the time to have this conversation.
Thanks, Maureen.
So we will kick things off. And it would be great if you could just start by introducing yourself and telling us a bit about your background.
Yeah, so I'm Dr. Nikhils. I'm the co-founder and CEO of a health tech startup called CancerAid. And in terms of my background, I've previously been a radiation oncology doctor, and I was working at the hospital. And 3 years ago, I came up with this idea for an app which is called CancerAid. And it's been quite a fun journey for me. I've shifted from clinical medicine into this new field of digital medicine. And it's something that's been quite new to me and quite rewarding. I've found a new passion where I feel like I'm able to help even more patients than ever before.
Awesome. So that leads us right into CancerAid. It'd be great if you could share, about the work that you're doing there, and then just talk about kind of the company in general. So how many people are on the team, the amount of money you've raised, just so we can get a sense of the stage as well.
So CancerAid, for my co-founder Raghav and I, started 3 years ago. We've designed an app to address issues that we saw day to day whilst working in the hospital. We've launched our app to the App Store, and we already have the #1 cancer app in not just Australia, where we're from, but also in the US and the UK. And we're an early stage health tech startup, but we've got 14 team members right now. And I guess one of the great things about us having experience in oncology, it has allowed us to raise investment, which is 1.9 million from 3 rounds to date. That's allowed us to build our product and take it to market. And it's also allowed us to sign up early customers.
Great.
And, yeah, the next stage of our company is expanding our I guess, team in the US outside of Australia.
Okay, excellent. So I'd love to turn to kind of your experience in the program, and the first question that I have is what drove you to participate in the program, and maybe there was something you can point to that made you say, okay, this is what I want to do with the next 3 months of my company's life.
Yeah, so for Raghav and I, we'd found that we'd had more traction with US customers a bit quicker than what we were doing in Australia. And so one of the reasons why, and probably the main reason why we explored the opportunity to come to the US and participate in this program was for us to take advantage of leveraging a network. It's very hard to do that on your own. So we were looking for a channel partner, and I guess the Cedars-Sinai Accelerator powered by Techstars was a great opportunity for us to build out our network and leverage the expertise of Cedars-Sinai Hospital and also Techstars to reach more customers and grow our business in the US, which was a market we wanted to really start to explore.
And so what experience had you had with the US market before entering the program, and how did that interaction with, really the US healthcare market, which is this huge undefined thing, but what was that like during the program, working so closely with the US health system?
Yeah, so for us, our user base had been growing in the US, and it was great because our app is free to patients. We've been finding that traction, but in terms of our customer base, we'd been able to leverage a few introductions here and there to meet a few customers. And I think for us, being accepted into this program allowed us to reach and meet more potential customers in a shorter period of time. So the way I like to think of it is we had 2 years of business development jam-packed into 3 months, which was great. Being able to leverage the expertise of all the contacts at Cedars-Sinai Hospital was also very appealing. So we've never had a health system like Cedars-Sinai open their doors for executive staff, operations staff, legal, IT, and clinical staff. And it was great for us because we had a value proposition which we thought was quite strong before coming into the program, but meeting all those different staff and team members at the hospital and the health system allowed us to refine that value proposition so that we knew exactly what we were building for a US health system, which is our main target customer. So for that, it was invaluable to our experience.
Yeah. And so it would be great if you could elaborate a bit on your experience working with the mentors, both from the Techstars side of the equation and also, the champions and mentors from Cedars-Sinai while you were in the program.
Yeah, wow. So the Techstars mentors were incredible. They did whiplash us, and we did meet hundreds of mentors that did pull us in, trying to challenge us with different aspects of our company. But the best part about that is we were able to, I guess, gain insights into experts in their fields, and everyone was very helpful and wanting to, I guess, give first with the mantra of Techstars. So from that, we were incredibly grateful. It wasn't just customer introductions, but also introductions to other aspects of our company. So partnerships, investors, legal, IT, recruitment. We've found a great bunch of mentors who we've continued to, I guess, engage with and leverage their expertise after the program. And I guess for us, it was great to build out our own network. We knew we had a network in Australia, but now we feel like we've got a very solid network that we can leverage in the US. In terms of the Cedars-Sinai mentors, they were fantastic. Even before we started the program, even in the interview week, everyone was very welcoming, and we really appreciated that. I think it helped that we were from Australia, so we were kind of like a different flavor, I guess, to some of the other companies.
Indeed.
But meeting different executive champions, especially of the cancer clinics and health hospitals, but they were able to, I guess, teach us and allow us to learn what a US healthcare landscape looks like. We know how the Australian landscape is and works, but in terms of the US, it was quite new to us. So it was great from that point of view. The IT department opened their doors up, and we were able to integrate our cancer app into the EMR workflow, which was a first for us, and we're actually the first cancer app to achieve that. So we're very grateful for them. But yeah, all the clinical staff that we met, all the oncologists, nursing staff, they've been great champions, and then we're really looking forward to working with them over the next 12 months, and they're very excited as well.
Yeah, so do you want to talk a bit about kind of how that engagement continues after the program? I mean, I know that we're only a few days after demo day, but what do you see, the next 6 or 12 months looking like for CancerAid?
Yeah, so we came into the program with 4 key objectives. One was to sign up, and the top was actually to sign up Cedars-Sinai as a paying customer, as a health system, and we're very fortunate to be given that opportunity and securing that deal. So for us, the next 12 months involves deploying CancerAid in 3 large clinics in February. And over the next 12 months from February, we're expecting to build out 4 new feature sets, which I guess have been shown of interest from Cedars-Sinai. And for us, what we're trying to do at Cedars-Sinai is reduce ER visits and 30-day readmissions for cancer patients. And we're trying to do that actually through better symptom management. So we'll be on the ground engaging with a lot of different clinical champions to deploy our software. The marketing teams have been very helpful as well for onboarding patients. But for us, we're trying to prove value to a health system so that we can reproduce that to other health systems in the US who are our target customer.
Great. That sounds like a very exciting and busy next year or so.
Yeah, we're looking forward to it. What we hope to do is actually reproduce what we've done at Cedars-Sinai and reach some other health systems. And I guess the good part about our app is because it is free to patients, we know the health systems are already using our app and having their cancer patients using it. So yeah, Cedars-Sinai is very great in that they will be happy to be a reference customer, which I think is very important when you're trying to scale a startup. So for us, it's a wonderful opportunity. It's a 12-month journey, which we hope to convert into an even longer journey.
Excellent. So you want to talk a little bit about maybe some of the most challenging aspects of the program and some of the highlights?
Yeah, so easily the most challenging was the fact that we are an Australian company coming to the US. So I don't think we sorted out this issue, but every week we had a communication issue back with our Australian team. The Techstars mentors were great. Matt, Omkar, and yourself, Maureen, helped with, I guess, some strategies of how to keep everyone in the loop. I think it's very hard for two operations to be working simultaneously in two different time zones, but our development team and our Australian team members were very patient with us. I feel like we were able to learn so much in 3 months that it was hard to catch up the rest of the team with what we're doing, and sometimes the communication issues were quite evident. Towards the end of the program, it got a bit better, and we started to implement some of those strategies. But simple things like, so Raghav and I, who are 100% in the program, we would dial into our team members on different calls in different rooms, and that way give them a sense that everyone's kind of equal and we're not having discussions without them. Mm-hmm. Also, we kept a Google Hangout link open each afternoon, so team members in the Australian office could just ask us questions and we could be a bit more accessible.
Yeah.
And I think that as well. But easily the biggest challenge we had was the fact that we had an Australian team that was 10 sad faces back home that weren't in the program. But for us, I think the operational costs of bringing everyone out and participating in the program would have been hard to justify. I think we were a bit disadvantaged having only 2 team members really participating in the whole program.
Yeah.
But I think if you did have an opportunity to have more, it would definitely be better. But we did okay with 2.
Yeah, you guys made it work, but it is challenging having a team on the other side of the world, quite literally. And how about some highlights from the program? It can be anything, really.
Highlights. So probably, we came into the program with 4 key objectives. One was signing up Cedars-Sinai as a paying customer, and we achieved that, which was great. The second was to integrate CancerAid into the EMR workflow, which we were able to do, which was also great. The third was we had 4 paying customers, before the program, and what we wanted to do was find out which of those customer segments to focus on and why. And it was a good opportunity with meeting different people from Techstars and Cedars-Sinai to understand that our value proposition lies with the health system. So we've narrowed it down to hospitals, and that's what we're focusing on for the next 12 months. So that objective was quite nice. And I guess for our main reason of exploring the US market, it was to scale our operations into the US. For us to do that, we need to build out our team with sales and business development in the US. So the fourth key objective was actually to raise investment to do those things. And we're in the process of finalizing that deal as well. So
great. Excellent.
I think, and one of the other highlights, I guess, would be just sitting around other health tech companies that are going through similar challenges. We ended up having like a really nice family and a nice group. It's quite sad to leave everyone and we're all in our own little paths, but we're all keeping in contact and sending messages on Slack and WhatsApp and stuff. So
that's great.
The highlight would be making a really nice family with the other companies, Techstars and Cedars-Sinai.
That's fantastic. And so I guess just to round us out, would you recommend this program to a company that was similar to yours? And what advice would you give to a company in advance of participation?
Yeah, definitely. I've said this many times, but like this program was the single greatest thing we've done as a company. And we have been through another accelerator before, and this was a very different experience for us. So any company in health tech that is at any stage, I think, can find value in this. If health systems are your primary customer, it's invaluable. And I think, especially for Australian companies, I've told you this, Maureen, like it's very hard for us to crack the Australian market because the health landscape for hospitals and budgets is very different. US. So for an Australian company, I think it's quite important to have a channel partner like Techstars and Cedars-Sinai to scale to the US. I actually think it'll be quite impossible to do it without assistance like the program. So I would always recommend other companies to do this, and it's really hard to justify until you actually take a dive in. And for us, it was a dive. So we had to explain to a lot of our existing investors, what this opportunity meant, why we're giving up some equity to participate in the program, and how it's going to benefit our company long term. And everyone's seeing the results, and everyone's on board with what we've achieved.
That's fantastic. Well, yeah, it's well deserved. So thank you so much for taking the time to chat and answer all of my questions. I really appreciate it.
Yeah, thanks, Maureen.
Okay.